My name is Karen Elkind-Hirsch, and the title of my presentation is The Use of the New Anti-Diabetes Medications in the Treatment of Women with PCOS. Polycystic ovary syndrome is a common heterogeneous heritable condition. We now recognize that PCOS is not only a hormonal and reproductive disorder, but a cluster of metabolic abnormalities driven by insulin resistance and hypersecretion of insulin. It is linked to an inherited resistance to insulin action, but is aggravated by lifestyle problems such as obesity, poor diet, and physical inactivity. Central adiposity and weight gain are common in women with PCOS. We now find that the incidence of glucose intolerance, dyslipidemia, gestational diabetes, and type 2 diabetes is increased in women with PCOS at a young age. The realization that hyperinsulinemia is a key component in the pathogenesis of PCOS provided a basis for advances in treatment strategies for women with the disorder using diabetic therapies in patients with polycystic ovary syndrome. There is no specific drug that has been approved by the FDA with an indication for PCOS. And actually, lifestyle modification is the only currently licensed treatment for weight loss for overweight, obese women with PCOS. Efficacy is limited by low compliance in this patient population, and certainly another alternative for the obese patient is that of bariatric surgery. Pharmacotherapy with anti-diabetic medications has become a popular and effective treatment for PCOS. Drugs that improve insulin sensitivity have been used for the treatment of women with PCOS, with metformin being the drug most extensively studied in this syndrome. However, considerable variability in the metabolic response to metformin has been observed in women with PCOS, attributable to several potential factors, such as different doses of the drugs and different genetic backgrounds. Early studies in PCOS suggested that metformin indirectly reduces insulin levels, dyslipidemia, and systemic inflammation. However, recent placebo trials have failed to demonstrate such a significant metabolic effect in the obese patient. Weight loss has claimed to be a beneficial secondary effect of metformin, but the effect is not very consistent. Furthermore, a number of studies have substantiated the view that obesity itself may reduce the benefit of metformin treatment. Other antidiabetic agents that have been used to treat these women are associated either with weight gain, like the TZDs, or being more weight neutral, such as metformin. However, numerous therapeutic advances have emerged, including oral and injectable pharmacogenics. Recently, a number of newer anti-diabetic medications have been approved that facilitate weight loss and improve the underlying insulin resistance. Incretin-based therapies represent a new class of anti-hyperglycemic drugs for the treatment of type 2 diabetes. The gut-derived incretin hormone, glucagon-like peptide, or GLP-1, enhances glucose-stimulated insulin secretion after a meal and lowers glucagon secretion. However, rapid degradation by dipeptidyl peptidase 4, better known as DPP-IV, and renal clearance of GLP-1 levels result in a very short half-life of 1 to 2 minutes. Two approaches were then considered to enhance the incretin effect in type 2 diabetes, that is, to either administer GLP-1 receptor agonists that are resistant to being cleaved by DPP-IV or actually inhibit DPP-IV enzyme activity itself. The incretin mimetics, which are long-acting GLP-1s, bind to the GLP-1 receptor and mimic the action of GLP-1. They are also resistant to degradation by DPP-IV. The DPP-IV inhibitors, which are an oral medication, extend the half-life of endogenous gastrointestinal GLP-1 and therefore prolong its effects. These pharmacological approaches therefore effectively increase the half-life and increase the circulating levels of incretins. Glucagon-like peptide receptor agonists, or GLP-1RAs, are peptides that mimic the native hormone, binding to a receptor, eliciting the same effects at much higher pharmacological levels than the physiological profiles. They cause glucose-dependent insulin secretion, promote weight loss, and also may subsequently improve insulin resistance. They are administered only as a subcutaneous injection, either daily or in weekly forms. This slide shows the very first study to examine the impact of treatment with the GLP-1 mimetic Exenatide. It was found in women with PCOS to both improve weight and menses regularity in obese women with PCOS. There have been a number of other studies looking at the effects of liraglutide, another long-acting GLP-1 analog, in a subset of obese patients with PCOS and higher metabolic risk profiles, showing significant weight loss in combination with metformin as compared with metformin alone. In addition, another report confirmed that liraglutide had an add-on effect in weight loss in obese women with PCOS who had only lost less than 5% of body weight during a 6-month pre-treatment with metformin. Available clinical trials of GLP-1 receptor agonist therapy in the treatment of excess body weight in women with PCOS demonstrate that both exenatide and liraglutide are effective in weight reduction either as a monotherapy or combined with metformin. DPP-IV is a ubiquitous enzyme that's responsible for the inactivation of the incretin hormone GLP-1. The DPP-IV inhibitors are FDA-approved oral medications for type 2 diabetes, again inhibiting DPP-IV action and increasing the circulating concentration of the incretin hormones, as well as providing improved glycemic control, and thus allow GLP-1 to stay in the body longer and improves the control of glucose as well as reduce appetite. Our group did the first analysis comparing the effects of the combination of the DPP-IV inhibitor saxagliptin and metformin with the single agent DPP-IV saxagliptin alone and metformin alone on clinical, hormonal, and metabolic characteristics in women with PCOS who had also impaired glucose regulation. We showed superior efficacy, that is, normalization of glucose tolerance, mean blood oral glucose tolerance, glucose levels, insulin action, and menstrual cyclicity, as well as reduced abdominal adiposity with the combination of saxagliptin combined with metformin over metformin alone in the management of these pre-diabetic patients with PCOS. The newest class of anti-diabetic agents, the sodium glucose cotransporter inhibitors, better known as the SGLT2s, have not been investigated for the use in women with PCOS to date. The SGLT2 inhibitors work by increasing the excretion of glucose in the urine. The loss of glucose with the attendant calorie loss contributed to weight loss. The SGLT2 inhibitors promote weight loss, have a low incidence of hypoglycemia, and complement the action of other anti-diabetic agents such as metformin. In addition, improvements in beta cell function in diabetic patients have been seen. Because the SGLT2 inhibitors have a distinct mechanism of action that is independent of insulin secretion, the efficacy of this class of drugs is not anticipated to decline in the presence of severe insulin resistance, commonly seen in women with PCOS, because they work by increasing the excretion of glucose in the urine. The weight loss that's been seen with the SGLT2 inhibitors is similar to that seen with the GLP-1 agonist and may be more acceptable because they are oral agents. We are currently involved in an ongoing clinical trial that is comparing SGLT2 inhibitors alone, GLP-1 agonists alone, and combined together in obese PCOS women. The potential therapeutic effects of this combined therapy, alone and in combination, has never been evaluated in a subpopulation of obese women with PCOS. The non-diabetic female with PCOS offers a unique model to study the relationship between insulin resistance and adiposity. Women with PCOS demonstrate abnormal body composition that is characterized by a greater percent body fat mass, and increased ratio of fat to lean mass. Recently, a higher dose GLP-1 agonist, liraglutide 3 milligrams, has been approved by the FDA for weight loss in obese adults as an adjunct to a reduced calorie diet and increased physical activity. We are now beginning to look at a double-blind, placebo-controlled 32-week trial to examine the therapeutic effects of the liraglutide 3 milligrams versus placebo in obese, non-diabetic women with PCOS. This study will look at the efficacy of this weight loss drug on both not just the reduction of body weight, but other hormonal measures such as the normalization of free androgens, as well as body composition, reproductive function such as return of cycles, as well as metabolic and other cardiovascular parameters in a well-defined group of premenopausal, obese, non-diabetic women with hyperandrogenism, focusing on the relationship to obesity and insulin resistance. Thank you for watching and listening to this discourse.